Hello everybody, I'm Dr. Tony Carrion. I just want to introduce you a new way to approach prosthodontics using the Urmareste laser. This is a partnership with Gazelle Dental Solution, and we are discussing a little bit about science and clinical practice applying the laser on prosthodontic field. So, first of all, it's pretty important to us to understand the basics of this kind of laser, because we can use the laser to approach the tooth, the gum, the bone, the restoration, ceramics or composites, and of course to finish with a very beautiful frame of this aesthetic smile. It's the frame is the lips. So for more than 30 years, the laser is known about the accuracy of the laser. It's very accurate. The reason then the eye surgery, the surgeons is using very well the laser and achieving a lot of benefits with the laser, because it's they don't need to numb the patient. The post-op, it's amazing, and of course to numb is only drops, so it's totally different than in the conventional. When we have to use the cold blade, we need to use anesthesia, and of course the post-op is not so easy, and the accuracy of the surgery, it's not so comfortable for the surgeon to do. With the laser, it's giving to you benefits to improve your surgery. So the same kind of laser has been used in the eye surgery, we are using for dentistry. It's an Urmareste laser, and we are achieving the same benefits on the eye surgery in our mouth procedures. So the laser is always working in 4 pillars. The laser is working no matter what kind of tissue or the kind of procedure are you doing. So always are you biostimulating the tissue, always are you disinfecting the tissue at the same time, and are you offering a minimally invasive procedure, and of course a very comfortable experience for the patient. So the laser is always being using combining the light of the laser, the water of the tissue, and of course the movement that you are handling the laser. So the laser is minimally invasive because always is working in a selective way, because the laser, when you cutting hard tissue, it's impossible to you to make any damage in the soft tissue, so the laser is always protecting you. In another way, when are you doing caries removal, like decay removal, the laser is only removing the decay. It's impossible for the laser to remove the dentinal health tissue or even the enamel. So this kind of protection of the tissue, it's made by laser. It's always offering you a good opportunity to you to work very safety in a very safety mode for your patients. So better than you buy a machine, a laser machine, it's most important you implementing this machine in your daily practice. The reason then, always we are offering training for the laser customers to implementing the laser very quickly. The laser is a very easy way, is a very short learning curve to be fluent in the laser using. So it's very easy to use, very easy to understand. It's a very friendly platform. So always the people are hearing things about laser, but lasers are not the same. Laser has their own difference, and those main difference it's offering totally different behavior over the tissue. This is pretty important to us to know what kind of laser we are talking about. So we are talking about erbium laser, but erbium, you have a few types of erbium laser. So our laser has name and surname. So our laser is an erbium YAG laser. So inside of the handpiece, so our machine has not fiber optical. The laser source is inside of the handpiece, so it's a direct laser delivering energy. This is offering a very good laser performance over the tissue. Inside of this handpiece, you have the laser source. The laser source, it's made by a crystal. This crystal is achieved by stone, so it's a garnet stone. So we have a garnet crystal doped by ions of erbium, yttrium, and aluminium. When this crystal receives the electric energy, those ions is changing the polarity, and when you are changing the polarity, the light it's made. So, and this is the process to achieve the light, and this kind of light has the properties of the light. So we poor human beings, we can just see a few colors. So our range of colors is very small. We can see from the yellows to the violets and from the yellows to the reds. Before the violets we have the ultraviolets, we cannot see, and after the reds we have the infrareds, we also cannot see. When we check this chart is explaining to us about the wavelength that we are talking about, like the diode. The diode lasers is the most known lasers in the dental field. Those lasers has their own properties. So the lasers on low level therapy, all high power diode laser, it's interacting with hemoglobin and also melanin. So it's possible for this kind of laser to work over soft tissue. When we wanted to use this kind of diode laser to work on a hard tissue, for example, to decontaminate a root canal, we needed to paint the bacteria with dark pigment, because the hemoglobin and the melanin to the diode laser, it's a dark pigment. And when we are using to decontaminate this same laser to decontaminate a root canal, for example, we needed to paint the bacteria using a blue methylene. But we are talking about an erbium YAG. The erbium YAG is a little bit far inside of the infrared range of colors. So, and this kind of wavelength will interact with two different things. It's interacting with hydroxyapatite and also water, but preferred water. And when we are using this kind of laser, we are working in a very different way. And I wanted to show to you, even within the erbium laser family, we have they're different. So has another wavelength that is the erbium chromium laser, and the ideal water absorption coefficient, it's around 3000 nanometers. So our erbium laser has 940 nanometers, so it's very near than the ideal ablation coefficient point. So the erbium chromium is a little bit far, but this small distance offer a very different behavior, a very different way to cut. So the erbium it's cutting 200% faster and 200% more efficiency than the erbium chromium. So for us, this erbium chromium laser, you see like water laser equipment, for example. So and the light touch has the same wavelength than photona. If you are working with interacting with hydroxyapatite and also water, we can approach the gum because the gum has water, the tooth has hydroxyapatite and also water, the bone is the same, a lot of water, a lot of hydroxyapatite, and of course we can do therapy. Because to do therapy with the erbium laser is because it's quite easy to kill the bacteria, because the body of the bacteria body is made by water. So the laser will find this water, will interact and blow up the bacteria. This is the way that we are cleaning implants with periimplantitis, and also cleaning periodontal pockets, okay? And also to decontaminate the root canal. This is the representative image of all tissue laser, because we have here a bone graft removed by erbium laser, and here a gingival graft removed by the erbium laser. So it's an all tissue laser. This is the basics of the laser, because it's pretty important to us to understand what we can do with this kind of machine, because our approach in a prosthodontics field we will need to interact with other professionals like the periodontist, like the surgeon, and it's important to us to know the behavior of the laser and what the laser can do for us. So here I wanted to show how the laser is performing over the soft tissue. I can do the incision, and also I can release the flap of the incision, this incision flap, using the laser. This is very, very gentle way to release this kind of flap. So it's the light of the laser. So are you seeing only one tool I'm using to do all this kind of procedures? This is the main reason that I love laser. I love erbium laser because I only using a single tool to do a lot of procedures in the same patient. So I'm releasing the flap, and now I'm cutting this flap like just to simulate like gingival flap. I will release this. I will cut this gingival tissue off, and after this I'm doing peeling to offer a better vascularization to this graft, to give to the gingival grafting procedure a better integration of the tissue. So now I'm changing the tip. I'm just changing for another tip to do the gingival peeling, okay? And are you seeing that I'm creating a structure to improve the vascularization. So are you seeing this is appealing? It's very simple, very easy. So I'm doing all those kind of procedures using only one tool. Now I'm doing osteotomy, like we are doing a crown lengthening. So are you seeing I'm not cutting the tissue, I'm evaporating the tissue. The tissue is just disappearing. Now I'm cutting. So depends of the way that are you aiming the laser to the tissue, the behavior will be different. Okay, so after to clean this kind of bone, now I'm approaching the soft tissue, and are you seeing how selective is the laser? I'm cutting the bone, but I'm not doing any damage in the soft tissue. Now I'm doing a tooth sectioning. So I'm doing a tooth sectioning. Are you seeing very quickly to cut a root or to cut a crown or to make a cavitation. So to the laser is pretty important to us, because when we are working in a prosthodontic field, the soft tissue is mandatory. The soft tissue will allow us to do the rehabilitation, to place a crown, to place a veneer, to place onlay. So we are always trying to improve the quality of the soft tissue to the gum has a better condition. So this kind of laser is very safe, because the action of the laser is superficial. Where I'm aiming the laser is interacting only there. But the most known lasers in the dental field is the diodes and neodymium yang. So check, this name is very similar with Urmareste laser, but the behavior is totally different, because neodymium and diode has the same behavior in interacting with melanin and also with hemoglobin. So when I'm aiming this kind of laser over the enamel, the light is crossing the enamel, the dentinal tissue, and will try to interact with the hemoglobin inside of the pulp. So this can offer for this pulp a pulp injury, so an inflammatory process. This is the reason that those kind of laser is not allowed to us to do cavitation, because it's interacting with hemoglobin and melanin, and I don't have melanin and hemoglobin in the enamel and also in the dentinal tissue, only in the pulp. So the reason then those kind of lasers not allowed to us to work in a high power to interact with hard tissue. So it's important to us to understand what is the minimally invasive concept. It's because with using the laser will ablate just what we want to the laser ablates. Here, this paper was done in 2009, is saying like the Urmareste laser ablates just the caries tissue, keeping the integrity of the tooth. So this is offering to us an idea that the laser is always protecting us to not offering to our patient an iatrogenic process. Okay, so the laser has many benefits. So we are working in prosthodontic fields. We need to understand what is the behavior of the laser over the tissue, and of course about the adhesion process. If I'm cavitating the enamel and also the dentinal tissue, if it will make any problem for our adhesion process. So the laser, using the laser, we we come to conclusion that the laser treatment possesses the requirements of the minimal invasive dentistry, the possibility to ablate a small area of infected layer, guarantees maximum conservation of the tooth structure, and using the antibacterial property. This is pretty important because after a dentinal cavitation we are killing all the bacteria, so we are protecting to this tissue is not happening secondary caries. It will give into us problems to our restorative process. So this is pretty important because when we are using the laser, when we are removing a crown or also a veneer inlay only or a fragment, the dentinal tissue is clean. The laser is cleaning this dentinal tissue. So, and we can decontaminate the affected layer and retains the remineralizing potential. So we are biostimulating this. The lack of smear layer after vaporization with the laser assures a better retention of the composite resin to the dentin. So we are improving the retention of the composite of the composite, the resin cement, for example. We are offering a better adhesion, a better retention to the dentin, and preparing the enamel surface with the laser. So when we are removing a decay, for example, or we have a specific parameters, just to you to do a laser etching before to do the SD etching. Okay, so and doing this it will give a better marginal seal of the composite restoration. So it's pretty important that the laser is doing a new morphology over the enamel of or over the dentinal tissue after the cavitation or after preparation, and this will give to us a better adhesion. So all the material, it's where you has the evolution of the material, but it's important to us to see the morphology of the tissue after the laser irradiation. So here we can see the enamel after a decay removal. For example, we have in the border of in the enamel border we have this kind of morphology. It's like the etching morphology, and also in over the dentinal tissue after the laser irradiation we always have the dentinal tubules opened. Okay, so this laser is not capable to do melting. We are only opening the dentinal tubules, and this is changing. Also we has adhesion material evolution during the years. So this article was done in 2020, and the conclusion that they has it's the pre-treatment using an Urmareste laser opens the dentinal tubules without the formation of a smear layer and improves the bonding strength between the primary teeth dentin and the resin composite. So the adhesion is always improved when you use the Urmareste laser for the dentinal tissue irradiation. This is a simulation about the cavitation process of the laser. It's important to us to understand when we wanted to draw something like a marginal crown tissue, and you wanted to draw using the laser a better marginal tissue, and also has a better delimitation, interacting in the same time with the hard tissue but not doing damage in the soft tissue, because you wanted to place this crown in the same moment. So here is the effect, and the selective way to the laser is working is because we have a different water quantities in the tissues, in the different tissues. So in the enamel has the two 4% of water, the health dental tissue 12, and of course to the decay we has more water. We have more water. This laser loves water. We don't need high power, we need less power to, not low power but less power to do a decay removal. But this less power that we are using is not enough to cut the healthy dental tissue. The reason then, when the laser arrives of the dental health tissue, the laser is not capable to cut more. So this is the way that the laser is always protecting us when we are working in a prosthodontics field, for example. This is for a cavitation, but this is a way to us to understand how the laser is working over over the tissue. Maybe when we are changing crown, you has a kind of infiltration, and in this infiltrative process you has a kind of caries decay, so you are using the laser to clean, to disinfect, and of course to promote a better morphology of this dentin, to improve your restorative process. And of course, most important than it's the laser cannot cut the dental health tissue when we are using the caries parameter, but the laser can penetrate in low level energy and will kill all the dental tissue bacteria, and this is offering to us the good disinfection of the contaminated dentin, prevents a failure of the restorative process occurred by secondary caries. So we are cleaning the tissue, we are offering for this tissue better cleaning, and of course remineralizing process. So let's talk about debonding, because we are going now to the what we can do with the laser only for prosthodontics procedures. So the most known procedure is debonding, because the laser will interact only with the cement and will debonding the veneers or the crowns, and of course the all restorative materials metal free. So this paper, I achieved this paper in 2013, and this paper surprised me when I read the title. This is using the Urmareste laser to remove porcelain veneers in 60 seconds. In the first view I thought two things. So, or this author is a big liar, because if you did a veneer porcelain removal, you know it's not only in 60 seconds using the burr. And in the second time I thought, oh, this guy has the magic that I need. And when I were approaching this paper, I saw this is minimally invasive way, efficient and safe. And when we are reading the abstract, we can check that for more than 30 years the porcelain veneers have provided to clinicians with a method for changing patients' smiles almost instantaneously. At times, however, veneers require replacement due to caries, fractures, leakage, or simply because the patient is unhappy with the aesthetic outcome. So this is very personal perceiving, because the patient has his own idea about the outcome that he is expecting, and sometimes it's not easy to us like a clinicians to translate the thoughts about the rehabilitation. You can do the mock-ups, you can do videos, you can do the ESD, you can do a lot of things to try to translate what is this the desire, the smile desire of the patient. So, and sometimes we are not being effective about it, and we needed to change. So, and when we have to change the Urmareste laser, it's possible to be used. I had another fifth reason to replace veneers. It's because I'm placing a veneers, I'm doing the cementation, and during the cementation process I place this veneers in the wrong position. So the veneers is perfect, the prep is amazing, the soft tissue is unbelievable, the cement colors is in the right, I did the right pick of cement color, but during the cementation process I did a mistake. So I needed to do this veneer removal because only this situation happens when the marriage of the son of the patient is in the next day. So you needed to do to solve this issue quickly. But if we are using burrs, what we have to do? We have to cut the veneer, we have to make a new prep using a retractor wire again, took a new impression or scanning, sent to the lab and pray for our technician to do in the right color, mimetizing with the neighborhood pieces. So it's not easy, okay? But with the laser I can do the removal and I can stay with the lithium disilicate as a single piece, like he's saying here. So because it's predictable, remove all porcelain restoration. So the title is saying to us about veneers, but here in the abstract I'm reading that it's about all porcelain restorations, inlays, onlays, crowns, fragments, and of course veneers. So I can do this, and while also keeping them in one piece. I can remove this veneer if I did a wrong cement colored pick. I just will remove, clean everything, choose the right color of the cement and cement again the same piece, okay? Or if I has some kind of infiltration process or caries, I can remove, clean everything, remove the caries and place the same piece again. But the most important thing, it's because the laser will serve to me like a new tool to don't use the burr, because if I'm using the burr will remove more than the veneer will remove health dental tissue. So what is the magic? The magic is because the cement has light reaction to have the adhesion process. What we are doing with the Urmareste laser, we are using the antidote, because if here I has the poison, in the opposite side I has the antidote, okay? So it's because this laser has a light in this side, and the opposite side has the violet to do the light cure. So this is one case that the patient, so for me it's good, but the patient wants something more natural. Okay, I will do the removal. Let's be focused on the lateral. About the red color is the cement, and I will pass over, and the laser, the veneers is working like a glass, so the light will pass through the veneer and will find the water present and the cement will interact with the water of the cement, and of course it will degrade this cement, and the veneer will be out. So I pass over the buccal side, the distal side, the mesial side, and to the lingual palatal side. And after this irradiation, I love the lacron to do this, because I'm approaching the soft tissue and use this tool just to take it off the veneer in the same acts of placement. Okay, so after this I'm seeing only the remaining tissue without any damage, and if my patient wants something more natural, I'm offering something more natural. But the most important thing, if the patient wants something artificial or natural, if I need to change, I'm keeping the tooth integrity. Okay, this is the most important. And if I needed to change 10 times I can do it without any concerning, because the laser is protecting the remaining tissue. So most important than buying a laser is implementing a laser. Okay, I'm always, when I'm approaching the patient, I'm always starting in the hand of the patient, because I want the patient relax on the chair. So the reason then, when the laser cuts hard tissue, we will not make any damage in soft tissue. I pass over the hand of the patient, and the patient will feel more calm down, because in the hand he's perceiving that it's not cutting, it's not hitting, it's not doing any vibrations, just feeling the water. So if I'm washing his hand, I'm washing his mouth. This is the perception of the patient, and I have a very collaborative patient, very calm down, very confident, because I'm not removing more than veneer. Okay, this is our victory. So here's a live case. This kind of case, we are always training doctors to use the laser. I just take it off the light of the chair, and now we can see white bubbles. These white bubbles is showing that the laser is interacting with the cement. I pass over the buccal side. Now when I pass over the mesial side, I saw the veneer moving, and I will take my mirror and will drop the veneer over the mirror, and I will show this veneer in the eye of my patient, because I want the patient remember when we place this veneer, I show it the same veneer, and so he's remembering about that the veneer aspect. So if I just showing the same piece, he's thinking, and this moment they just remove the veneer, not touching or not preparing more the remaining dental tissue. So this canine is flying out. Okay, and here I'm just approaching the central, the incisor, and I wanted to show to you it's quite easy to do it. So the same, buccal side, distal side, white bubbles. So I'm not protecting the soft tissue, because when we are using the hard tissue mold, is not affecting the soft tissue. So now I go to the mesial side, and I'm seeing, so the veneers is flying out. Okay, it's quite easy. Why? One of the main reasons that I love this technology, it's because it's quite simple to start to work. So I remember when I started to use scanner, for example, took me a few months to be fluent. but with the laser in one day are you totally fluent. So now I did 3 veneers removal. Now I'm passing the laser to one doctor that I'm training, so she saw I'm doing, she's just copying the movement, and you do, and you will see she's not so calm down. She's a little bit afraid because it's the first time that she's handling the laser. Of course, it's normal. So you can see she's using 10 fingers to hold the handpiece. This is normal. But what's the most important? The most important is the performance. So she's using for the first time and she's removing faster than me. So it's not depending of the expertise of the professional. So are you starting work with the laser, your performance will be good like on a very expert professional. Okay, so and the same thing will happen. I'm always prefer to start removing the lateral because the central and the canine are big pieces. So when I remove the lateral, I have all the medial canine side and also all the distal. So you saw, very easy. She's thinking that she's a superhero. Okay, and now to remove the central, I has opened the total mesial side, distal side, and palatine side. So applying the laser, irradiating the laser over the buccal sides, and done. Okay, this case I did in Israel. Okay, so I was training Dr. Sasha, and after 3 seconds it's done. This is Dr. Sasha laughing a lot because he's saying it took me 3 seconds, as I usually spend an hour to do this. Okay, but this case, for example, I had a problem with infiltration. So what I'm doing, I'm just protecting the other tooth that I don't want to interact with the cementation. I'm just protecting with the metal because the metal will not allow the light to cross. And just remove, I will clean, and I will re-cement again. This is a veneer cemented over customized abutment. Okay, so I had a problem over this veneer. I will just debond the veneer because it's a very aesthetic area. It is central, and I don't want to lose the most important thing is the conditioned tissue. So I don't want to lose this. Okay, so I just remove the veneer. Now I will take a new veneer. I will re-cement the veneer. I will cement the veneer here, and after we'll unscrew this crown, and we'll screw over the implant already cemented veneer. Okay, just because I don't want to cement inside of my biological space. Okay, so this is a behavior of when we are removing a feldspathic. Feldspathic with ceramics, it's impossible to reuse. Okay, because the laser will vaporize in the feldspathic. So do you remember the 10 fingers girl? Now this doctor is working. Okay, this is accelerated video just because I don't want you to check how is the dynamic of veneer removal. Okay, so she is working by herself. After one case, she's feeling very confident. She checked it's impossible to hurt soft tissue, so just apply the laser. The laser it's very selective. So she is working like playing a new toy. Okay, this central is a crown. What is the difference during the laser radiation? I'm doing the palatine sign like I did the buccal side, and the crown it's out. So another veneer. Okay, I applied the laser, check it, try to remove, not use the laser a little bit more. Okay, and now after the debonding I will removing very easy. Okay, what is important? It's important that here I can use the laser to conditioning this tissue, to clean this tissue, to do cement excess that it's possible to you to have. This is the reason that you have some kind of resection, and the dentinal, the gingival tissue is not in a good condition. I will prepare this tissue with the laser to have a very good soft tissue healing. So this is Dr. Evelise showing the veneers that she already removed, but now she is not using in the same patient because we need retractions and gingival recession, and we need a new. But if it's only wrong cement color chosen, we can just place again the same veneers. Okay, so now what we can do, we can clean. It's just to using rubber, to a diamond rubber to clean. Okay, because the cement present over the tooth is not more hard like a cured cement. Now it's the bonded, degraded cement, so it's quite easy to clean, to check. Now I want a new color, so it's a prosthodontic procedures, but check the health of the gingival tissue, so we can approach to clean here all the tissue, and also we can do conditioning of the enamel to achieve a better adhesion using the laser. This patient is from Canada. She came to Brazil to do her case. We told her that this is a very, very bright veneers, but she took a decision that she wants, and after 4 months she came back to Brazil to make a removal. We did the removal. I sent it to my technician, is Mark Celestrino. He wrote this book. It's called Essentia. This book, it's an amazing book about relation with the prosthodontist with the technician. It's amazing. A lot of tips. It's done by Quintessence. Okay, if you check with Quintessence, you can have this book. It's an amazing book. Okay, so we can reuse the veneers, of course. Why is that? Because we has a paper telling us that the veneer debonded by the use of the Urmareste laser allows the dentist to reuse the detached veneer in some clinical cases when the preservation of this fixed prosthetics integrity is observed. This method is rapid because we took a few seconds to remove, clean, recement. The patient's done. 20 minutes, not more than it. Okay. Here is a zirconium crown that I wanted to show to you. Do you remember the Israeli guy that we are working on his clinic in Israel? Here I'm showing how to make a veneers removal, because this is the way that we are training doctors around the world. We do a few and we are sharing the same case. We do a few removal, and after the doctor do the other one. Okay, so just to you to check. This dark color is because when we are irradiating the laser, the cement is suffering a chemical changing. Okay, and the cement it's become dark. Just it's not temperature. This is a disilicate crown. This case we did in Salvador de Bahia in Brazil. Okay, so what we have to do, it's the same process that we did with the veneer, but here we have three faces. We have the buccal side, the occlusal side, the lingual side. So we just need to apply the laser, irradiate the laser over all these faces of the crown, and of course the four interproximal. So the mesial buccal side, the distal buccal side, and the mesial lingual side, the distal lingual side. So we have to approach the laser, we have to irradiate, aiming in the interproximal area. Okay, so this is offering to us a very simple way to make a crown removal. It's very, very simple. It's quite easy to do. So, and always for us, it's very interesting because I'm not using any soft tissue protection. Okay, so during the training, everybody's taking attention, is paying attention over the procedure and forgot to use the suction. Okay, so and I remember, so please take the suction because everybody's always very, very focused on the procedure. Okay, so now I'm doing the interproximal area. Okay, because I needed to offer to the cement a very good position of the laser to do the irradiation. So are you seeing a light reflection? This is not temperature, this is not fire, it's a light reaction, it's a light refraction. Okay, so now is the last interproximal area. It's impossible to do video capture, but it's just to pass a few times over the interproximal area. Okay, now it's done. Now it's important to you to check because we are using the lacron, but the movement is made by the finger. Okay, the lacron is just us to do a level up, but is the finger is doing the movement. So I can send this crown to my technician to change the color, to do everything, and again it's a chemical changing, cement changing. Okay, it's not temperature or nothing. So here we did this case in New York in the Jeff Shapiro Clinic in Manhattan. Okay, what I'm doing, the same, buccal side, palatine side irradiation, and after using the lacron and helping the piece to come out. It's quite easy. And so I'm doing all these kind of things using a single tool. So I'm not changing for nothing, just a single tool in my hand. Okay, I radiate. Okay, now I'm taking my lacron and we'll make the removal. Again, first thing, finger in the zenith, and use the same placement axis to remove. Done. So the fiber pin. The fiber pin is not irradiated. It's just the cement. Okay? Quite easy to do. Crown removal. What kind of crown material we can remove? Lithium, the silicate, feldspathic, and of course zirconium. But the PFM is impossible because the metal is blocking the light passage, so we cannot go through the crown because the cement, the metal, it's blocking to the light pass through and interact with the cement. Okay, so but when I need to make a fiber pin removal, I will degrade all the resin, protecting the dentin, okay, and the fiber pin, it's coming out because the laser is not cutting the fiber pin, just the material. Many people is using the veneer, composite veneer. The composite veneer is not detached, is just vaporized by the laser. So are you seeing here that I'm vaporizing, but it's impossible to the laser to cut the enamel because it's the same decay parameter to do the composite veneer vaporization. Okay, so see, you saw a little bit of the light interacting with the soft tissue, but the laser is not cutting. But why we are doing this kind of removal is because it's a lot of resin inside of the biological space. So after to do the veneer, the composite removal, here are seeing the blood coming because it's the resin, the gingiva, it's breathing again. So this is an expression that I always want to use because we are opening space to the gum breathing again. Okay, so it's very selective, very easy. But as I said in the beginning, we are just ready to work in a prosthodontic field. Is the gingiva, it's okay. I just wanted to show to you how I'm doing gingivectomy with this kind of laser, because the bleeding when we are working in a conventional method, it's implicated to us that we are delaying our restoration, our prosthodontics procedures, because we needed to wait the gingival recovery. So when we are working with this kind of laser, I'm not cutting the gingiva. What I'm doing here is I'm erasing the gingiva. It's a different effect that we are doing, that we are using to do gingivectomy. So minimal bleeding. So in the majority of the tooths you are not seeing bleeding, okay, because the laser, it's biostimulating in the same time, and after that you stop to cutting, the laser starts to do a healing process. Are you seeing here that I already did this canine, and this canine I took a lot of gingival tissue, and you are seeing a small bleeding, but after a few seconds this small bleeding stops. Okay, and I'm doing in a very, very conservative way. Just why I'm painting the marks of the zenith is because this patient is not numb. So the reason then I'm not using my probe to mark the gingiva, because I don't want my patient has any pain. So the reason then I'm using a marker, a CD marker. This is the immediate post-op, so this patient is ready to be prepped. This is the way, this is a video zoom about the procedure, just for you to see how to erase the patient's non-anesthesia. But when I need to do osteotomy, I'm always doing a flapless when I need to just to level up. because when I'm cutting hard tissue, I'm not cutting soft tissue, and it will allow me to do a flapless osteotomy. Okay, so I'm doing this because I need to cut the gingiva and after to recover the biological space. So are you seeing more bleeding? Because we are detaching a very gentle way, but more bleeding to do the osteotomy. But this patient is also not numb. Okay, this is a very didactic case. You are seeing the complaining of the patient is this lateral. I'm doing this case, I'm cutting the gingiva. I did this case in Caracas with Dr. Alamo. Here I just did the gingivectomy, and now I wanted you to check, because I did only the gingivectomy in April 23rd, and I asked it to the patient. She's also a dentist. The patient is also a dentist. I asked her permission to do the osteotomy the next day, because I wanted to show what is the problem that I'm finding in my clinical practice around the world. It's what's happening is the people they forget to respect the biological space and just cutting the gingiva and placing veneers. What is the problem? It's if you don't remove the bone, the gingival tissue will migrate to the next position. If you place a veneer here, all this tissue will want to grow over the veneer, but it's not possible. The reason then we need this, we are seeing a lot of cases with gingival problems. So, and then the next day I did the osteotomy also without anesthesia. Okay, it's a flapless procedure. All this surgery I did without anesthesia, no numb. She sent me, I flew to New York, and she sent me a cell phone picture after 4 days. Okay, but it's very stable, the tissue here, and after a week she sent me a very professional picture just to us to check that the smile is very stable, because we did it the right way, doing and respecting the biological space. So, and her first thought it was about to do veneers, but after this gingival results she gave up to do the veneer, and now she just did bleaching and of course some of composites aesthetics procedure, just it. But we had a lot of procedures to do with using this laser just to do a second stage implant surgery, because we offer to us a biostimulated emergence profile. This is very important to us to work with prosthodontics, because we needed to achieve a very healthy gum to place a abutment here. Okay, and this procedure is done non-numb and very good healing. Okay, I'm always doing the sensitizing process also, because I don't cement any piece without to do the sensitizing, because it's preventing about to my patients showing a kind of sensitivity. Okay, this laser is working on hypersensitivity, dentinal hypersensitivity. So I use the air, check what is the pain level, 0 to 10. He related 8 level. I'm just now using the laser and here in low level energy, low level power, okay, and I'm placing the laser, I'm irradiating the laser, and the laser is working to desensitizing him, okay. It's a dentist, the patient is also a dentist, suffering a lot in a very, very warm city in Brazil, and the sensitivity it's doing and making him feel very, very upset. But after a few, I took the air again and applying, and is okay, very impressed. What is the mechanism, desensitizing mechanism? So the laser, it loves water, interacts with water. So here we have the odontoblastus. It's always telling to the pulp it's heating, or it's cold, it's hot, someone is touching the tissue. So the odontoblastus is informing the pulp that something is happening. When we use the laser will dry the dentinal tubules, and the odontoblastus will will be retracted to near the pulp. So we are interrupting the communication between the pulp and the surface, okay. This is the mechanism. This paper is well done in 2002, okay, here 2002. This is the mechanism. So I wanted to say many thanks to the Gazon Dental Solution, to the Urpia platform. It's my third class that I'm showing here, sharing with you what is our laser dental practice. And I'm very happy because all those things that we are doing every day, after the desensitizing, we are offering a cold water to the patient, and of course all the patients is relating that they prefer the laser because the laser is offering a very, very comfortable and a very positive experience. This is what we are offering to our patients around the world. Okay, so this is my family, my contacts, and here it's my WhatsApp, but I wanted to meet you, all of you, in my Instagram. You can check everything there, okay. Has my Instagram, my WhatsApp, my Telegram, so I'm 100% available to you. Thank you, Urpia Dental Platform, and of course to Gazon Dental Solutions. Thank you, and see you soon in the next video. Thank you.